Please note that the individuals shown in this video are for illustrative purposes only and may not be actual healthcare professionals or patients. Thank you. Just right. Obsessive-Compulsive Disorder, OCD, is a subtype of OCD characterized by an overwhelming need for things to feel just right, or to be done in a specific, often perfect, manner. Unlike other forms of OCD, which might focus on contamination fears or unwanted intrusive thoughts, just right, OCD revolves around a deep-seated sense of discomfort or unease that something is not as it should be, even in the absence of logical reasons or external requirements. This need for symmetry, order, exactness, or perfection goes beyond ordinary perfectionism, deeply impacting the individual's daily life and emotional well-being. People with just right OCD are driven by an intense internal pressure rather than external obsessions or fears of harm. They might engage in repetitive behaviors or rituals to alleviate the discomfort associated with things not feeling just right. These rituals can include arranging objects in a precise manner, repeating tasks until they feel perfect, or performing actions a certain number of times to achieve a sense of completeness or satisfaction. The distress is not necessarily linked to logical concerns about consequences but rather to an intrinsic need to alleviate the feeling of incompleteness or wrongness. The compulsions associated with just right OCD can be time-consuming and significantly interfere with daily functioning. For example, an individual may take hours to leave the house because the process of dressing or arranging items to carry does not feel just right, or they may repeatedly check and rearrange items to achieve a perceived sense of order or symmetry. Treatment for just right OCD, as with other OCD subtypes, typically involves cognitive behavioral therapy, CBT, with a specific focus on exposure and response prevention, ERP. ERP therapy encourages individuals to face the situations that trigger their need for things to feel just right, without engaging in compulsive behaviors, helping them learn to tolerate the discomfort and uncertainty. Medications, such as selective serotonin reuptake inhibitors, SSRIs, may also be prescribed to help reduce the intensity of the urges and compulsions. Understanding and patience from family, friends, and coworkers are crucial for those dealing with just right OCD. Education about the condition can help reduce stigma and misunderstanding, supporting individuals in their journey towards managing their symptoms and improving their quality of life. With appropriate treatment and support, people with just right OCD can learn to cope with their symptoms, allowing them to lead more balanced and fulfilling lives.